It's late at night. The house is quiet. And then you hear it, that soft, rhythmic sound, over and over again. You look down and there's your dog, head down, focused, licking their paws like it's the only thing that matters in the world. You've seen it before, probably dozens of times. And every time you told yourself the same thing, they're just cleaning themselves. That's what dogs do. But here's what most owners never find out until it's too late. Constant paw licking is not normal grooming behavior. It is a signal, a quiet, persistent message that something inside your dog's body is wrong, and the longer it goes ignored, the worse it gets. Your dog cannot tell you they're in pain. They cannot tell you they're suffering. So they do the only thing they can. They lick and lick and lick. Today, you're going to find out exactly what that means and what you need to do about it. Before we get into this, drop your dog's name in the comments right now. And tell me, have you noticed them doing this? How often? You might be surprised by how many people are watching this with the exact same concern. Let's get into it. Hidden environmental allergies. Here's the first thing your dog's paws might be telling you. They're allergic, and you have absolutely no idea. Most people think of allergies as sneezing, watery eyes, the kind of thing you can see. But in dogs, allergies almost always show up somewhere else entirely, in their paws. When a dog with environmental allergies walks across your lawn, your carpet, or your hardwood floor, their paws absorb allergens directly through the skin. Pollen, dust mites, mold spores, even certain cleaning products you use every week. The result is an intense, maddening itch that your dog cannot escape from. So they lick, because licking brings temporary relief. It's the only tool they have. But here's the problem. Saliva keeps the skin moist. Moist skin breaks down faster, and broken skin becomes infected skin. What starts as an allergy turns into a raw, painful wound between the toes. Vets call it interdigital dermatitis, and it is far more common than most owners realize. Watch for these specific signs. Redness between the toes, a brownish or rust-colored stain on the fur near the paws. That staining is caused by a compound in your dog's saliva reacting with their coat over time. It does not go away on its own. If you see that color on your dog's paws right now, this is not something to wait on. Psychological self-regulation, stress, and boredom. Now this one is the one most owners dismiss, and it is one of the most important. Your dog might be licking their paws because they are not okay on the inside. Dogs are not designed to be alone for 8, 9, 10 hours a day. They are not designed to sit in silence with nothing to do and nowhere to go. But that is the reality for millions of dogs around the world. And when a dog's mind has no outlet, it finds one. Repetitive licking is a self-soothing behavior. It releases a small amount of endorphins in the brain. It's calming, predictable, controllable. In a world that feels uncertain or empty, licking their paws is one of the few things your dog can actually control. Behaviorists have a name for this pattern when it becomes extreme. Acral lick dermatitis, a condition where the dog licks so compulsively and so repeatedly that they create open sores on their own legs and paws. Sores that will not heal as long as the behavior continues. But the licking is not the real problem. The licking is a symptom. The real problem is a dog that is understimulated, anxious, or both. Ask yourself honestly, has something changed in their routine recently? A move, a new family member, a change in your work schedule. Dogs absorb the emotional atmosphere of the home far more deeply than we give them credit for. If the licking gets worse when you leave and stops when you come back, you now know what your dog is trying to tell you. Chronic internal pain and arthritis. This is the one that breaks people's hearts when they finally figure it out. Your dog has been in pain, quiet, constant pain, and every sign was there. You just didn't know what you were looking at. When a dog experiences pain or discomfort in a joint, a bone, or anywhere in their body, they instinctively try to reach it. If the pain is in their leg, their wrist joint, or their paw, licking is how they try to soothe it, over and over again. Arthritis in dogs is dramatically underdiagnosed. Studies suggest that up to 80% of dogs over the age of 8 have some degree of joint degeneration. But it doesn't only affect senior dogs. Larger breeds can begin showing signs of joint stress as young as 2 or 3 years old. And because dogs are wired to hide weakness, they won't limp dramatically. They won't cry out. Instead, they slow down slightly. They're a little less excited about walks. They hesitate before jumping up. And they lick. Specifically, persistently, always the same spot. That specific, focused licking is the key detail. If your dog is always returning to the exact same paw, the exact same spot, something is wrong in that location. It is not random. It is not boredom. It is targeted, and it deserves a targeted response. A vet visit with a focus on joint assessment is not overreacting. It is exactly the right thing to do. Parasites and fungal infections. The last reason is one of the most common and one of the most overlooked. Something is living on your dog's paws or inside the skin, and it is causing them constant, relentless irritation. Yeast infections are extraordinarily common in dogs, particularly in breeds with folded skin or dogs who spend time in damp environments. Yeast thrives in warm, moist spaces, and the space between a dog's toes is a perfect environment. The smell is the giveaway. If you've ever noticed a strangely sweet or musty odor coming from your dog's paws, that is yeast, and the licking makes it dramatically worse. Moisture from saliva feeds the infection. The infection intensifies the itch. The dog licks more. The cycle does not stop on its own. Mange mites and other parasites cause a similar pattern. Intense localized itching that drives a dog to lick, chew, and bite at their paws obsessively. In early stages, the skin may look only slightly irritated, but underneath, the damage is building. Here is what to look for. Swelling between the toes, skin that looks thicker or darker than normal, a foul or unusual odor, hair loss around the paws. Any one of these signs combined with persistent licking means it is time to get your dog examined. These conditions are treatable, completely and often quickly, but they will not resolve without intervention. So let's bring this together. If your dog is constantly licking their paws, there are 4 things their body might be trying to tell you. 1. Hidden allergies causing skin inflammation that you cannot see but they absolutely feel. 2. Psychological distress, stress, anxiety, or boredom that has become a compulsive physical habit. 3. Chronic pain or joint issues that they are trying to soothe the only way they know how. 4. A yeast infection, parasite, or fungal condition that is quietly getting worse every single day. None of these will go away on their own, and your dog cannot ask for help, but you just learned how to hear them. If you found this useful, share it with someone who has a dog. It might be exactly what their dog needs them to know. Subscribe to this channel if you want to understand your dog the way they deserve to be understood. We go deep into dog psychology, behavior, and health every single week. And leave your dog's name in the comments. Tell me what you noticed after watching this. They can't speak, but you can listen.